Hello and welcome to Module 1, Introduction to First Aid. In this session, we'll explore why first aid is essential in every workplace. You'll learn about its importance, current UK statistics, legal responsibilities, first aid kit essentials, and the basics of infection control. Workplace injuries are a significant concern affecting all sectors. Understanding the scale is crucial for awareness. Statistics show numerous fatalities and non-fatal injuries annually. Lost working days highlight the economic impact. First aid awareness is vital even in low-risk environments. Slips, trips, and falls are the most reported incidents. Handling and lifting result in strains and sprains. Being struck by objects or falling from heights are common. Acts of violence also pose a risk, especially in customer-facing roles. Understanding these helps in prevention. First aid is crucial in the initial moments of an incident. Ambulance response times can vary significantly. Immediate action can prevent worsening conditions. CPR is vital in cardiac arrests, impacting survival rates. This course aims to equip you for those critical minutes. First aid involves immediate help before professional care arrives. It aims to preserve life and prevent worsening. Promoting recovery is also a key goal. Boundaries must be respected. Only treat what you're trained for. Avoid diagnosing or giving unauthorized medication. UK law mandates employers to provide first aid facilities. The 1981 regulations emphasize adequate and appropriate measures. These depend on workplace size and risk assessments. Even small businesses must comply. Sole traders are not exempt from these duties. First aid needs assessment considers workplace hazards. Employee numbers and working patterns affect requirements. Distribution of staff across locations is crucial. Incident history guides future risk assessments. These factors determine the necessary first aid provisions. This course raises awareness but doesn't replace formal qualifications. The appointed person manages incidents until help arrives. First aiders have formal qualifications for higher risk sites. Recertification is required every 3 years. Employers must ensure trained personnel are available. Employers must provide a stocked and accessible first aid kit. An appointed person or first aider is necessary based on assessment. Information on first aid arrangements should be clear. Provision for lone and shift workers is essential. Record keeping for incidents is mandatory. Employees must care for their own health and safety. Cooperation with employers on safety arrangements is required. Reporting incidents and near misses is crucial. Proper use of equipment, including PPE, is mandatory. Knowing workplace first aid arrangements is essential. Workplace first aid kits follow the British Standard BS 8599-1. Essential items include plasters, bandages, and dressings. Gloves, tape, and cleansing wipes are also vital. Tablets and medication should not be included. First aiders do not administer medication. Higher risk environments may require additional items. Catering needs blue plasters and burn dressings. Driving requires portable kits in vehicles. Outdoor sites benefit from trauma dressings and communication devices. Mental health first aiders are increasingly common. First aid kits need regular checks and restocking. Monthly inspections ensure readiness. Used items must be replaced immediately. Expiry dates on sterile items need watching. Signage must clearly indicate kit locations. Infection control protects both the first aider and casualty. Contact with bodily fluids requires precautions. Bloodborne viruses and bacteria pose risks. Protecting both directions is crucial. Proper hygiene practices are essential in every intervention. Hand washing is a key infection control measure. Wet hands and apply soap covering all surfaces. Scrub for at least 20 seconds, including wrists. Rinse thoroughly and dry with a disposable towel. Use the towel to turn off taps and open doors. PPE includes gloves, face shields, and aprons. Gloves should be changed between casualties. Face shields protect during CPR. Aprons and eye protection are for splash risks. Hand sanitizer is useful when soap and water aren't available. Hand washing before and after contact is crucial. Gloves should be worn with any fluid contact. Cover personal cuts with waterproof plasters. Dispose of contaminated waste safely. Never reuse single-use PPE between casualties. Sharps must go in a yellow sharps bin. Blood spills require quick containment. Disinfect areas with diluted bleach. Report needle stick injuries immediately. Tetanus and hepatitis B vaccinations may be needed. Record casualty details and incident specifics. Note what injuries were present and first aid given. Include who provided first aid and any further action. Records must be kept securely under GDPR. Accurate records support legal compliance. Certain incidents must be reported to the HSE. RIDDOR covers deaths, serious injuries, and dangerous occurrences. Employers are responsible for reporting. First aid records often provide essential information. Understanding RIDDOR ensures compliance. This is the conclusion of the video. Thank you for your time and attention.